This is my capstone project on the contributing factors affecting sexual activity and pregnancy among adolescents. In this study, the research focuses on the relationship between the contributing factors and the proclivity to pregnancy among teens. Teen pregnancy has long been considered a national issue. The associated risk factors with teen pregnancy and childbearing not only affect society as a whole, they also affect the individual and their family system. Those risk factors include physical, developmental, and behavioral challenges for the children born to teen moms. The reason for concern is the long-term implications for both the teen parents and the children born to them. Teen pregnancy became a socially constructed issue when the rise of teen pregnancy, parenthood, and abortions in the U.S. became more profound than in other industrialized nations. What needs to be understood is why this country's teenagers become pregnant and have babies at higher rates than do teens in other countries. Identifying what are the contributing factors which increase the rate of pregnancy and parenting among American adolescents is the focus of this study. The variables tested in this study are micro, meso, and macro level factors. In addition, race and ethnicity were also considered as factors, particularly among the populations of African American and Hispanics. The research hypothesis is to identify the relationship between these variables which either increase or decrease this outcome of teen pregnancy. Teen moms are more likely to live in poverty, lack or not accomplish educational goals, and have long-term physical and mental health issues. These risk factors create the ongoing propensity to repeat the cycle of teen pregnancy and parenting among the children born to teen moms. For instance, 67% of teen parents live below the poverty line when they move out of their parents' home. Although the teen birth rate has dropped by 57% since 1991 and across all ethnic backgrounds since 2010, by the year 2020, 1/4 of the teen population will be Latino. This is an important factor to consider when implementing intervention and prevention programs. 1 in 4 teens will become pregnant before age 20. It is important to consider why this is a factor. Children are spending less time at home with adults and more time with their peers. They become heavily influenced by social image and the opinions others have of them. Also, the norms in their peer group influence contraception use. The predominant view that has been supported by the U.S. government is to promote abstinence-only initiatives through several measures. Those include the Adolescent Family Life Act, community-based abstinence education, and many others. The belief is that promoting safer sex practices would send an inappropriate message to students, which are believed to promote sexual activity among adolescents. Teens in America are no different than in other industrialized countries with regards to patterns of sexual activity. However, contraceptive use is less consistent among adolescents in the U.S., which accounts for the higher birth rates among this age group in America. It is important to verify the statistics across genders, which signify the rate of sexual activity and propensity to utilize safe sex practices. 43% of the nation's high school females reported ever having sex. This had dropped from 51% in 1991. However, males reported an even greater decrease from 57% in 1991 to 49% in 2001. Adolescents were inconsistent with birth control or did not use any method of birth control because they lacked appropriate knowledge and information about methods or they lacked access to contraceptives. The cost of teen pregnancy and parenting not only affect the adolescent, children, and families, it also affects society. The cost of teen pregnancy to taxpayers in 2011 was $10.9 billion, an increase of $1.5 billion from the year prior. $2.3 was spent on higher public sector healthcare, $2.8 on child welfare, 2.3 on increased carcerations, and 3.2 in lost revenue. The rate of teenage childbearing is associated with several variables. Studies have shown that the family environment of a single-parent household poses the highest risk for an adolescent and their likelihood of becoming pregnant. The correlation is due to the fact that these family environments are of lower, unstable socioeconomic status. The more limited economic resources within a single-parent household suggest that this creates a dynamic for these families which contributes to adolescent pregnancy. The most consistent predictor of adolescent pregnancy is a neighborhood with high rates of unemployment and poverty. There is a culture of poverty which suggests that economic difficulty creates a deficit for the future career expectations of youth. It also creates a model of complacency and dependence among governmental assistance programs. When there is no hope for the future, adolescent females in particular might seek out pregnancy and parenthood as the only future life goal. When a family's background includes low levels of educational attainment and income, this becomes modeled behavior for their children. If parents express values or model behaviors that increase the likelihood for sexual risk-taking and childbearing, adolescents are more likely to have unprotected sex and are therefore at an increased risk of becoming pregnant. For this study, data was drawn from the National Longitudinal Study of Adolescent to Adult Health. The principal investigators of this dataset are Kathleen Harris and Richard Udry. The target population of the dataset is a nationally representative sample of students in 7th through 12th grade from U.S. high schools that were selected based on their region, size of community, and ethnicity. A pair of schools from each community were then selected to participate for a total of 132 schools. The demographic variables of race and ethnicity were examined in Table 1. Of the 1,250 participants, 57% identified as Caucasian, 29% identified as African American, and the outcome of the analysis also identified that Caucasian participants outnumbered the Hispanic and other group combined by 43%. In addition, Table 1 also reports the findings that 19% reported having ever been pregnant as an adolescent, whereas 81% stated they have never been pregnant, and that includes pregnancies ending in miscarriage, abortion, stillbirth, and live births after which the baby dies. The relationship between having experienced a pregnancy as an adolescent and identified race and ethnicity was also examined using logistic regression. Participants who identified as Hispanic showed no significance in having experienced a pregnancy compared to Caucasians. Therefore, we would reject the hypothesis that Hispanic adolescents have an increased incidence of experiencing a pregnancy as a teenager. There was also a highly significant correlation between adolescent pregnancy and the African American participants. This high significance among this population suggests that African American teens are at an increased risk of experiencing a pregnancy compared to Caucasian participants. Therefore, we would fail to reject the hypothesis. There was also a slight significance among the Asian Pacific Islander and Native American group identified as other. This slight significance suggests that other races have an increased probability of experiencing a pregnancy as a teen compared to Caucasian adolescents. Therefore, we would fail to reject the hypothesis. The following independent variables were evaluated in this study: sexual education, peer influence, socioeconomic status, parental supervision, neighborhood, and contraception. As shown in Table 2, almost all of the participants reported that their sex ed course taught in school included the topic of pregnancy. Only 4% agreed with the question that their friends would respect them more if they became sexually active. and public assistance was not identified as a primary source of income in 90% of the households surveyed. Of the 1,250 participants in the sample, 60% of them reported using the reasonably effective method of contraception, which includes condoms, whereas 5% of participants reported using the highly effective method. Identifying whether lack of access to contraceptives or lack of knowledge and information regarding the methods available is an important factor to consider among this population, based on the results identified in this study. In Table 3, there were not many factors identified as being highly significant predictors at having an effect on decreasing the probability that an adolescent would experience a pregnancy. The most significant variable identified was the reasonably effective method, and there was moderate significance in the highly effective method of contraception. Adolescents who use birth control are more likely to use the reasonably effective method known as condoms. Therefore, we would fail to reject the hypothesis that contraception method decreases pregnancy outcomes in adolescents. According to this research, the results show that an adolescent who uses a reasonably effective method of birth control is less likely to experience a pregnancy in Table 3. The reasonably effective method includes condoms. According to the Center for Disease Control, condoms are the most common form of birth control used among teens, and it is also the least effective when not used correctly. There's an 18% chance of getting pregnant when using condoms as a birth control method. However, there is a less than 1% chance of getting pregnant when using the highly effective method of birth control. The CDC also reports that less than 5% of teens who use the highly effective method known as the long-acting reversible contraception. The CDC's findings go together with the findings reported in this study. It is important to consider why teens do not use the highly effective method. The CDC reports that teens do not use the highly effective method for several reasons. Those include lack of knowledge and understanding about the method and the way to use them. Many teens believe because of their age that they're not able to use highly effective methods such as the IUD, and the CDC also reports that there are barriers such as the cost of the highly effective methods and the lack in provider education and training. Even though teen pregnancy has declined since 1991, it is important to continue advocating for improved intervention and prevention methods and programs so that lack of knowledge and access are no longer factors affecting contraception use. Because children of teen moms are at a higher risk for adverse development, research needs to focus on how to assess stress among pregnant adolescents. Implications for future social workers should include adding postpartum depression scales to assessments. Other areas of improvement would be for the development of programs to focus primarily on improving the relationship between mother and child based on assessment scores. These programs would create a supportive environment which would add to the healthy developmental outcomes for mother and child. Adolescent pregnancy and childbearing are linked to several developmental outcomes on all levels, micro, meso, and macro. Therefore, future recommendations of research would be to 1. Study the effects on all 3 levels in order to be of better assistance for pregnant and parenting adolescents. 2. Would be to research the development of pregnant and parenting adolescents among all ethnicities and socioeconomic backgrounds evenly. Most current research has focused primarily on the adolescent whose background is of lower socioeconomic status and ethnicity. The sample of this study was not evenly distributed among race and ethnicity and therefore disproportionately evaluated this factor. And 3. Future research would need to identify what factors or resources would benefit teen moms to continue their education while still dealing with the reality of being a young mother. This concludes my Capstone project presentation. When teen pregnancy rates go down, opportunities go up. Join the national campaign to prevent teen and unplanned pregnancy this May to support the National Day and Teen Pregnancy Prevention Awareness Month. Thank you.